This video is intended to be educational for patients that are having a Shouldice hernia repair. So now you're home, you've had a night of sleep. It may not have been a good night of sleep, but this is the first day after a Shouldice repair. Well, you're in pain because it hurts. You've taken that Tylenol, Motrin, around the clock as we've advised you to. You're icing the area, but it's pretty uncomfortable to get out of bed. We need you to get up and walk, move, use the bathroom, go prepare yourself a light breakfast, or if somebody's helping you with breakfast. Your goal today is just to move around a little bit, as much as you can tolerate within reason. And also to give your body rest and time to heal from the surgery. So sitting in front of a computer or a television or an iPad, whatever it is you do for entertainment or talking to people, is certainly encouraged. You should not have plans to leave the house to join kids' physical activities or be driving today. You should really take this as sort of a rest day. Almost always the pain is manageable with Tylenol and Motrin. You will start noticing that there may be a little bit of bruising coming to the incision and a little bit of swelling beginning. Some patients have more swelling than others, but swelling after surgery is completely normal. That bruising and swelling actually increases in the first few days after surgery. So if you don't see bruising or swelling on the first day or even the second or third day, don't be surprised if it happens later on. We try to anticipate what happens to everybody, but everybody heals at different paces. The incision oftentimes will have super glue on it. It's purplish in color. The scar will be a couple of inches long, almost 3 inches long for a Shouldice repair. But you should expect a fair amount of pain in that area. It's going to be hard to get up from sitting positions or from laying down. It's going to be hard to sit down to go to the bathroom even. And so everything is difficult on that first and even second day. In fact, the first and second day are very similar to one another because the body's natural healing response is that swelling on a cellular level gets worse in the first 48 hours. And so day number 1 and day number 2 are usually the most uncomfortable days of the surgery. And so once you get through those, you know you're going to recover well. Usually on that first day is sometimes when I get a phone call asking for a prescription pain medication in that 1 in 10 patients that requires it. We don't want you to be a hero. We don't want you to suffer. We want you to have a tolerable recovery from a painful operation. And what that means is that you're able to get out of bed, you're able to go to the bathroom, you're able to shower on your own. If you can't do those things, that's where an opioid and pain medication might be helpful. The downsides of taking opioids after hernia surgery is that it can make you constipated. It can make you a little bit more dizzy or even loopy. You're a little bit more likely to trip and fall. And in 1 in 16 patients, there is the risk of becoming dependent on that opioid pain medication. For that reason, we have spent a lot of time working on and researching ways to reduce that risk for you. And the biggest thing is to avoid it. But if you can't, we write a prescription typically for 6 tablets in our practice just to get you through that first couple of days if you need it. If you do take an opioid, it's important to take a laxative or stool softener. So Senecot works very well. Colace, Metamucil, even Miralax are things that people use. You should add to whatever it is that's your baseline. So if you're the kind of person that takes Metamucil every day, maybe add a little bit around the time of surgery. It's normal not to have a bowel movement that first day after surgery. It's okay if you do, but oftentimes the stress of surgery, the different medications that we give, both the local anesthetic and the sedative anesthesia, will slow your system down. And so don't expect everything to work perfectly. The rare worry on the post-operative first day is that your pain is not manageable with anything. I have personally seen that once in the last decade, and that should prompt a phone call to the office. Otherwise, hopefully I've given you a pretty large background of what to expect on that first day after surgery.